Welcome, my dear friends, to the Health Journey. I'm Dr. Michael Harris. If you're watching this, you've likely crossed the age of 50 and realized that health is no longer a given. You've seen that number on the blood pressure monitor and you've asked yourself, do I have to live with this forever? For years, I've witnessed a painful trend. Too many people after 50 start accepting illness as an inevitable part of aging. They tell me with a sigh of resignation, I just have to live with these pills with high blood pressure and diabetes. This acceptance, this belief in inevitable decline, is a dangerous misconception that the medical system has inadvertently perpetuated. The core message: blood pressure is a messenger, not a master. High blood pressure is not just a number. It is the messenger. It is the honest voice of your nervous system and your blood vessels. When it's too high, it signals a profound imbalance. Expert insight. Recent studies prove that chronic high BP isn't just due to age. It's driven by insulin resistance and a stuck sympathetic nervous system. The ANS, the two pedals of your body. I want you to imagine this. Your body is driven by two pedals. The sympathetic system is the gas pedal fight or flight response, accelerating heart rate, BP, and muscle tension. The parasympathetic system is the brake pedal rest digest and DNA repair, slowing everything down. Most of us in modern life are stuck with the gas pedal pressed down. Today, we will learn how to forcefully engage that brake pedal using 17 scientifically proven strategies. Uncontrollable systems and the bridge of breath. The philosophy is simple. You cannot consciously command your heart to slow down, but you can command your breath. Conscious breathing is the only bridge between your conscious mind and your autonomic nervous system. The problem: most people breathe shallowly and rapidly, around 18 breaths per minute. This leaves only about 1 second of exhale, which is insufficient time to activate the parasympathetic system fully. The solution, the exhale, is the switch that activates your relaxation response. The target rate: 6 breaths a minute and proper mechanics. The target rate: slow your breathing down to 6 breaths per minute. Inhale, 5 seconds. Passive. Exhale, 5 seconds. This increases the time spent activating the brake pedal by 5-fold. Deep practice guide. The 5 to 5 count diaphragmatic breath belly. First, 3 seconds of an inhale. Your belly should expand. Always initiate breathing here. Coastal toes, thoracic breath chest. Last 2 seconds. Your ribs and chest should gently expand. Passive exhalation, 5 to 6 seconds. Completely relax the muscles. The air should passively flow out. Crucial note: proper slow breathing is silent breathing. No sound means you are relaxed and not straining. The cold shock and emotional multipliers. Cold water therapy. Instant interruption. Intervention. Splashing cold water around 10 degrees on your face. Mechanism. This instantly triggers the mammalian dive reflex, dramatically slowing the heart rate and reducing BP acutely. The emotional multiplier practice. Combine breath with visualization. Inhale vitality, joy, and exhale stress, worry, or burdens. Word focus. Silently saying the words peace or calm during the exhale reinforces the neural pathway. The superiority of isometric training and arterial flexibility. Now let's talk about the muscle side. We need to focus on arterial flexibility, making old arteries soft again. D. Isometric exercises. Static. Hold research shows that static holding exercises reduce blood pressure more effectively than traditional aerobic training. Mechanism. Static muscle contraction helps the artery walls reprogram their flexibility and reduces peripheral vascular resistance. 1. Wall sits, and 2. Squat holds evidence. Wall sits reduce systolic BP by an average of 10 points comparable to a mild medication. Actionable tip hold: for 30 seconds, work up to 3 minutes. Repeat 3 to 5 sets. Crucial warning: always breathe smoothly to avoid lightheadedness or syncope. 3. Planck's efficacy reduces BP by 3 to 8 points. Trains nervous system resilience under pressure. NEAT and comprehensive resistance training. Comprehensive resistance training. Beyond Static holds traditional resistance training is necessary to build the largest glucose furnace muscle mass to solve insulin resistance. Limiting sedentary time. NEAT. The active philosophy: minimizing time spent sitting. NEAT. Non-exercise activity. Thermogenesis is crucial. WHO guidelines recommend minimizing sedentary time to improve circulation and insulin sensitivity. Actionable tip: set a timer to stand up and stretch every 45 minutes. The metabolic pillars: insulin and electrolytes, solving the root cause, insulin resistance strategy. Cutting highly refined carbohydrates and sugar is the most effective way to turn off the kidney's salt-retaining switch. Potassium optimization and sodium reduction. WHO guidelines: electrolyte strategy: increase potassium 4,700 milliohm a day as recommended by the WHO to serve as the critical counterbalance to sodium. This facilitates the necessary sodium-potassium pump function. Advanced supplements for vessel and neural health. Omega-3 and aged garlic extract. Anti-inflammatory, vasodilation, omega-3 reduces chronic inflammation, and aged garlic extract boosts consistent nitric oxide swash. Help the vessels relax from within. Magnesium glycinate. Neural support, balance. Mineral supplementing: magnesium glycinate is key for vasodilation, neurological stabilization, and improving sleep quality, which directly reduces morning BP. Mindfulness breaks and gratitude practice. Stress reduction: use short mindfulness breaks to interrupt the stress thought loop. Gratitude practice actively reduces activity in the amygdala, the brain's fear center, lowering chronic stress hormones. Sleep brain reprogramming and long-term gains. Sleep: the nightly reset, expert view. Sleeping less than 6 hours is an independent risk factor for high blood pressure, AHA. Actionable tip: keep the room cool and dark. Sleep is when your body clears out cortisol and resets insulin sensitivity. Neuroplasticity: making calm permanent. The ultimate goal: consistent practice of the breathing and movement strategies will permanently rewire your vagus nerve, making the state of calm your body's default. The impact of consistency and the Robert Principle. The Robert Principle: consistency is crucial. Remember Robert. He wasn't perfect. He relapsed and his BP spiked. But he returned to the program. The greatest lesson: perfection is the enemy of progress. Don't strive for perfection. Strive for consistency. Long-term impact: reducing your systolic BP by just 5 to 10 points results in a 15 to 20% reduction in stroke risk, AHA data. This small number translates to massive life protection. Final action and the challenge. Now for the final charge. Check and act. Always ensure accurate BP measurement per CDC and AHA standards so you are never incorrectly dosed. The final challenge. You don't need to do all 17 strategies. I challenge you to commit to 3 slow breaths every time you remember, and schedule 5 minutes of stillness daily. I believe in you. Do not accept metabolic syndrome as a normal part of aging. Your body has the capacity for reversal. The choice is yours. Start today. If this video was helpful, please subscribe and share it with a friend who needs it. Breathe slower, live gentler, and love your heart every single day.